Um, so we usually start our webinars with a land acknowledgement. And so I'd like to begin by acknowledging my sincere gratitude for the opportunity to work and live on this beautiful land that has been occupied by First Nations since the beginning of time. Today I am situated in Ottawa, Ontario. The city of Ottawa is built on the traditional unceded territory of the Anishinaabe Algonquin Nation. PCMCH recognizes that Indigenous practices of health and well-being have been in place in this territory since time began and are maintained to this day. We are committed to honoring and improving our knowledge on these practices. We recognize the harms and mistakes of the past, and we take meaningful steps toward reconciliation by building and improving relationships with First Nations, Inuit, and Métis peoples. For me, taking meaningful steps means making a personal commitment to continuous learning in my professional and personal life. And as my work is focused in population health, which is fundamentally concerned with early intervention, equity, and the social determinants of health across the lifespan, I would like to share a link to a video that spoke to me and my work. The video is from a First Nation perspective, but one that I feel is relevant to all of us in our work, particularly in support of children and youth and families, and building or rebuilding healthy children, families, and communities. I believe we shared this video previously with our Pediatric Diabetes Network, but I will share this link in the chat with you. It is called The Social Determinants of Health from a First Nation Perspective. Before we start, and I'll hand it over to our presenter, a few housekeeping items. You'll be able to post questions in the Q&A function on Zoom or use the raise your hand function. All participants are automatically muted, but when you raise your hand, we can give you permission and then unmute you to ask your question. And we'll aim to save about 10 to 15 minutes after the presentation for Q&A and discussion. So without further ado, I would like to introduce today's speaker, presenter, Sasha Delorme. Sasha is a happily married Métis woman with 2 sons and 2 stepchildren. She grew up in a small town in Saskatchewan with her mother, who was adopted through the 60s scoop. So she is learning about Indigenous culture as she works on projects and speaks about life with diabetes. Her son has type 1 diabetes, diagnosed at age 2 in 2014, and she has type 2 diabetes diagnosed in 2020. Sasha has spoken at and planned several diabetes events in her city, done grant reviews for Diabetes Canada, contributed to the work of published projects, and recently helped plan and facilitate anti-racism in healthcare workshops. She has been chairperson of the Indigenous Patient Circle in Diabetes Action Canada and a member of the Collective Patient Circle, always eager to help shape diabetes research. She has been on the Sex and Gender Research Committee and Knowledge and Mobilization Committees. She is currently the Diabetes Canada, on the Diabetes Canada's Person with Lived Experience Committee and the Community T1D, a mental health initiative for people living with T1D. Sasha now works as research coordinator for the CanScreenT1D project and is looking to make meaningful connections with Indigenous allies. Thank you so much, Sasha, for being with us here today, and I'll hand it over to you.
Hi, thank you so much for having me today, and thank you so much for the introduction. I'll just, I guess, start from diagnosis of my son. I just wanted to kind of get into that backstory about, how I ended up in this work that I'm in. And it's a pretty unique situation. And I guess I'll explain to you later on why that is. So my son Brayson was diagnosed when he was 2 years old. And because, we didn't have that family background, we didn't know that it was even a possibility to have type 1 diabetes in the family. It came as a complete shock and just totally changed our lives. So with all that being said, my health was, put on the back burner because of my son's health, which was always front and center. And so for, the first 2 years, it was a very isolating, very scary time for my family and myself, learning the literal ups and downs of diabetes and, the lows and highs. And it's scary when kids are so little. So it was a lot of, trial and error and figuring out on our own, what diabetes is and, how to manage it. So from there, we met some parents in our own city and started a group that got together and just, talked about diabetes, life with diabetes. And, it was so different just talking to people who understood our life, right? Because up until that point, for the first 2 years, nobody did, nobody got it. So that really opened up the doors for me in my advocating role. I just saw, that there was this extreme need for people to come forward and talk about diabetes. It was still kind of, one of those topics that wasn't discussed very much. And I think it's more, the generations before us that kind of like to keep it private. But, when we came up in this diabetes life, it just, I liked to share things. I liked to get out that information and that knowledge, especially to Indigenous people, because for one, type 1 diabetes isn't very prevalent, but type 2 is. And a lot of the same symptoms, um, are the same between type 1 and type 2. So, anyways, advocating, I started with Diabetes Canada and JDRF and doing events and hosting meetings and things like that, and really got into the life of diabetes. And so from there, I started advocating for Diabetes Action Canada, which is Canada-wide. And I really, found my purpose, and I just really jumped in with both feet. And, that opened the door for so many different opportunities coming to working with researchers on projects to do with diabetes, making life better, impacting, people with diabetes that are living with it every day. And, that just really, I don't know, it just sparked this passion in me. And so from there, I was actually offered a position within the CanScreenT1D consortium, which is where I work now. And there's so many good things that we are doing. I will get into that once I show the slides and what we've done over the last year. There's still 3 more years to go with this. So, it's so nice being a part of these talks here, and hoping that I can meet some people who would like to work with us and join our journey of equitable and respectful screening for children with type 1 diabetes across Canada. And so I lead the Indigenous side of that project. And yeah, we're always looking for new members, but I'll tell you more about that as we go. And so with all that being said, can we please share the first slide, please? Awesome. Okay, so this is our Indigenous Advisory Circle. As you can see, there aren't very many of us. I would like to get it up to about 15. So like I said, we are actively looking for new members and some elders specifically. But so far we are mostly, there's three of us from Saskatchewan, and then a couple from Manitoba, BC, Quebec. We try to, spread across Canada because it's very important to have those voices from everywhere. We don't want to just be stuck in one region and finding out what works and doesn't work for one region that could work for another. So that's the Indigenous Advisory Circle. If you know of anybody that would like to join this team, I'll have my, LinkedIn showing on the screen afterwards. Next slide, please. So some of the things that our team has done since 2024, we created our logo. And if you see in the top right there, it's like an eagle, blue, white, and red. We went with the blue, white, and red because that's the CanScreenT1D consortium colors, not to be confused with the United States. But that's why we went with those colors. And that is just to show, I like to put my stamp on the work that we've contributed to, or videos we've made, or any infographics, just so people know that it came from this Indigenous group, and that, we've kind of put our stamp on it, saying that this is something that we really like to back up, I guess. Okay, so there's the logo, and then we have also, I can make my screen bigger here. So we've also hosted an Indigenous anti-racism workshop. So the point of those, we find, or feel is that in order to, have these researchers trained and going out to Indigenous communities for type 1 screening, it's important that they first learn the culture, right? Like the background of Indigenous people and, why things are the way they are right now when it comes to healthcare for Indigenous people. So, like I said, we're just very, very passionate about, teaching those grounding cultural views and why it is that we use tobacco when we smudge, or, like cultural teachings that really get people to understand, how it was in the beginning for us and what was taken from us. So it's just really important to start from the very beginning in order to work ourselves back up. So that's why we do these anti-racism workshops, and they are geared towards research trainees, anybody involved in healthcare, basically anybody who should be learning about the Indigenous culture in their work. And then, so we've presented our work and project in person and online. So just like today, I've done other online webinars just to really put the word out there and see who would like to work with us. And when I say Indigenous allies, I don't just mean Indigenous people. I mean, any race, any color, any culture that is willing to be an ally to our people. There's so many different ways that, we can work together, whether that's making, creating, editing resources that are out there or not out there. Let's get together and work on these things, that everybody's missing when it comes to knowledge. We want to be able to share that knowledge. So we are, very interested in presenting our work and putting that out there and hopefully making some more relationships as we go. All right, and then I will move on now to the 7 principles of ethical engagement with Indigenous communities. So our group came up with these 7 different words here. I won't get into them, but we will be able to share them afterwards. So I can send them through email or however, so everybody can get a copy. But basically, we decided on these important words that we think that everybody should follow when doing their research. So it comes down to things like respect, obviously showing ways that you can respect that community and be respectful. So we have some examples that you can use in your own work. So that's a pretty helpful thing that we've created there. And then we are also training on Indigenous data sovereignty and community needs. So when I say that, we are just in the beginning kind of talks of that. We've started a committee of Indigenous data sovereignty experts who will advise us on those nuanced kind of things that happen, when it comes to biosamples and storing and, managing and all those things. So if there's something that comes up that doesn't really sit right or doesn't fall under the certain categories, when it comes to storing or doing certain things with biosamples, we can come to this group of advisors and see what they think we could do. They're very knowledgeable. They have all sorts of ideas for us, to start off with. But again, we are also looking for other people who are maybe in that space right now and extra knowledgeable or, want to share some information. So that's another really big topic right now is Indigenous data sovereignty. But also with that, the community needs training or not training, community needs survey is something that we will be starting right away as well. So that's another thing that we're also looking for people to work with on, what are the questions we should be asking when we go into community? What are their main needs? What kind of health disparities do they deal with on a daily basis? And every place is so different. One of our ethical engagement things there says not to assume that any 2 places are the same, even if they're, very close in proximity. Different communities will have different needs and, there's different ways to go about assessing them and, addressing them. So there's just so much to be done in that space as well. So community needs survey is something that is in the works right now. And we are also looking for people who would like to work with us on that as well. So there's just so many opportunities with this project that, I like to include other people on. It's not just for me. It's not just from me. It's a compilation. It's a beautiful work that all of us have done so much, thinking and so much knowledge using and gathering and, putting that together. It's heart work, it's hard work as well, but it's heart work is what I say, because it really does come from the heart. It's passion. It's, driven by people who are affected by this every single day. So it's one of those things that, you need a bunch of voices to be able to truly capture what it is that we need to do to go forward in a better way. So, yeah, with all that being said, can we have the next slide, please? All right, so I talked a little bit about this. So what we're doing is creating the Indigenous Data Sovereignty Protocol. That is our goal for 2026. We're actively looking right now. We're actively, starting that project, that part of this project. So again, if there's anybody that would like to join, please contact myself. We are creating community priority surveys. So that's something as well. We're always looking for feedback or ways that, the surveys can be distributed. Who are we missing? Who needs to be amplified in this work? And then host in-person meeting for survey results. So that will come later on in the year. Once we gather these results, we want to host some kind of a meeting to talk about these things, right? Like, what are the main things that come up? What are the things that a lot of people, need help with or need more resources on, kind of thing. So there's work to be done in that space as well. And then lastly, we're very passionate about creating and updating diabetes resources. Something that keeps on coming up in this work is that there's just not enough out there, especially for Indigenous people specifically. So when it comes to, cultural knowledge or, just even the traditional foods that Indigenous people eat, there's just so many different aspects of life with diabetes for Indigenous people that we really want to get into. So that's another thing. If, you're a group that would like to create or update diabetes resources with us, please contact me. That's something that we're also very, very passionate about. Yeah, so how can we collaborate? So different ways are, making videos, sharing videos about thoughts about diabetes and life with it, or making infographics, simple things that would explain something that's a little more complicated for people with diabetes, or, things that are more tailored to youth because there's not very much out there. And when Jennifer spoke about the CanScreenT1D thing that I'm a part of as well, that's something that, could be used for youth or adults. It's a website that was started. It was funded through, I think it was JDRF. And yeah, so it's just like, this platform that's online. People can go and chat together who have diabetes or are affected by diabetes in any way, type 1 specifically, but it will eventually will have some space for type 2 as well. But it's just kind of getting started. And again, it's like a research project. So it's also aimed to find out, certain data about what is it that we're missing out there. So there's all sorts of things going on. And a lot of this work, does kind of come together in my own project. And it kind of creates these networks that allow us to be able to work with so many different people. So it's really great work to be done. And we're absolutely looking forward to meeting so many different people in this great opportunity. Next slide, please. All right, so I will quickly talk about this. This is my poster that I will be presenting at the Diabetes Canada conference later on this month. And it just kind of goes over what I've spoken about to you so far. What we've done, what our goals are, what our aims are, why we decided to do the for example, the Indigenous anti-racism workshop. Just really kind of talking about those pieces, and I will be going over, the things that we've done and the things that we aim to do going forward. So this is the poster. I'll just kind of quickly say, since I've got right up here on the screen, the Indigenous community engagement. So there's those 7 words. I will quickly say what they are: research, respect, relationship, reciprocity. That's a huge thing. So reciprocity, we don't just want to go out to a community, ask for data, and take that and leave and then not come back. That's not what we're about at all. What we want to do is find out what they're missing, and if we can help in any way, whether that's connecting them to other researchers who could come up with these answers for them, or maybe it's just a simple matter of sharing things that we already know exist. So reciprocity is huge. We always want to make sure that we're not only taking from the community, but giving back is the important part. And then the 5th word, relevance, and then reflect, and reconciliation. Being able to put these things into action when you're out there, not just saying, oh yeah, I'm an ally, but how do you actively, show that you're an ally? So that's a big part of our work as well. We're always looking for ways to, bring these main, what are they? Yeah, just main research aims, I guess, into your work. So I think that's my last slide now. And I guess, yeah, if there's any questions, I would like to open that up to you guys, or maybe Jennifer wants to speak next. But thank you for your time.
Oh, thank you, Sasha. This is really wonderful work, and so aligned with some of the things that we've been talking about in our group, our Pediatric Diabetes Network. And so there's so many opportunities for learning here and collaboration. I know I see some people who are participating today who we've had discussions with about these very things in the last few weeks. So I'm wondering, I had a chance to look at your poster, and I wondered if you could expand a little bit on the population health or population level T1D risk screening in newborns and children in Canada.
Oh, yeah. Sorry, I didn't
Oh,
get much into that. I was talking more about the work that we've done. So, yes, great question. So, okay, so in Canada, I'm just going to quickly go over this little introduction box here. Many children affected by type 1 come into the hospital at diagnosis in really, really bad condition called diabetic ketoacidosis. My son Brayson was almost at that point, but not quite. So that's why they figured, I have some knowledge in this area. And so the Canadian population screening for risk of type 1 diabetes is exploring the acceptability and feasibility of population level T1D risk screening in newborns and children across Canada. So it's it's a Canada-wide project or consortium, and I'm just leading the Indigenous specific part of it. So with this research and screening and everything, what they want to do is find out, what are the logistics of making something like this work in Canada? Is there a need for it? First of all, are people wanting their children to be screened for type 1? It's never been done in Canada. It's been done in other places, but, Canada has this different history, especially when it comes to Indigenous people, which is why we've got to take all these extra steps along the way. So anyways, the screening that CanScreenT1D does is going to do is really for everybody. We want to find out, how many kids are at risk, which regions are more at risk. There's so many different variables in this work, and we aim to, find out how's the best way to screen people? Where do we screen people? Do they want to do at-home screens versus, inside a clinic or something like that? So there's so many different answers that we're hearing. And with all this information, we put it together, and we're trying to find and create the best package that there is to be able to do this screening work in Canada. So with all that, when kids come into the hospital with DKA, it's because they don't know the signs and symptoms. They don't know that there's this high risk category that maybe their children were in. So with this project, they aim to hopefully be able to not only figure out or see who is at high risk for it, but also to prolong that process. So say if this child comes in with a greater risk assessment, and they're thinking, okay, this child could have diabetes a few years down from now, kind of thing, then in that time, maybe they'll come up with different medications or something that can prolong the disease, or, eventually stop it from coming altogether. So, those are things that we're all looking forward to. And this project is something that really has all these different arms to it, that's really checking out all these different aspects of this project. So I hope that kind of answered your question, Jennifer.
thank you for that. Yeah, yeah. Now, I'd like to reach out to the group who's here and just ask if anyone else has questions for Sasha. You can put them in the chat, or Allison, I'm not sure if you have questions that have come up from the group.
No, there's no questions in the the Q&A box or the chat. But if anyone is typing, we'll give them a couple minutes just in case.
Sure. Sounds
I know
good.
I talk a lot too, so I probably.
That's wonderful. While people are typing, I have another question. Given that you yourself have type 2 and your son has type 1, is your son involved in your work? And what does he think about it? And, how does that kind of process go?
Yeah, so that's a good question. When he was younger, we did a lot of advocating with him, right? He was very into it and happy and, always, eager to meet other families and other kids. But as he grew up, I feel like, he's 14 now. And I feel like he's in this maybe burnout stage of it, because he doesn't like to talk about it. He doesn't like, people asking questions about it. He doesn't like drawing attention to it. So he kind of likes to keep that more quiet. But on the side, I do have him help out with, when I'm making infographics or, I'll ask him questions like, hey, bud, what do this means when I read him something, say like Indigenous data sovereignty. I'll explain that to him or read it to him and ask him in his own terms, what do you think this means? And it's just nice to hear that youth perspective on something, that simple terms, that lay terms kind of way that we're always pushing for. And it doesn't really seem to click with a lot of people. So, I think that it'd be, back to basics. And I like to include his words and his thoughts in those kind of ways in my work. So he is quietly working in the background without knowing it.
Yeah, that's great.
Yeah.
Yeah. I mean, I think that would resonate with some of the people here again in that in their work, they might see those same kind of reactions and feelings about, from youth and teenagers at that stage in their journey of
Yeah.
diabetes. Yeah, yeah. So you'd be a very good youth advisor. Um,
Still
yeah,
not
again, I'll
seeing
just
anything. So maybe
okay.
maybe
Okay.
maybe you've covered it, Sasha. Thank you.
Yeah, that's wonderful. So, yeah, just if anyone I'm just going to give this last opportunity for anyone to put comments in the chat or ask any questions you might have before we wrap up here. Um, okay. All right. Well, again, I'd like to thank Sasha so much for being here. She will be presenting that poster at the Diabetes Canada conference in November, correct? And I think it's like 26th to the 29th, and then
Yeah.
it's in Toronto, so some of you might be going. Yeah, I have one question that's come through. Um, if I could ask that to you, Sasha,
Sure.
it's a question. It's how do you define Indigenous data sovereignty, and does your definition differ from your son?
Hmm. Okay, so for me, well, data sovereignty is, you go back to the OCAP principles, ownership, who owns it, who controls it, who accesses it, who possesses it. But when it comes to Indigenous data sovereignty, it is different because we haven't had a good history of, research or being, researched. That's what's happened. It's not, how do I explain this? So Indigenous people have not been researched in a good way, when it comes to, oh, there's just so much on that topic that it's hard to even think of where to start, right? But so there are so many different things that have happened in Indigenous culture and Indigenous history, things that were taken away, things that, when it comes to colonialism, our rights, our culture, all these things have been affected and displaced, in our, when it comes to Indigenous data sovereignty, to me, that's not only, making sure that Indigenous people own their own data in any kind of way, data, whether that's biosamples, stories, records, histories and stuff like that. It's just so important that they have all say and all access to their own personal and community records, because it's all been taken away in the past and people have been studied and poked and prodded. And, one of these things that comes to my mind, this came from an Indigenous elder, and I will leave this with you, is she said, we have been studied, poked, prodded, everything you can imagine. And, you know, by the end of it, what was the result? She said, the researchers got their diploma. And, you know, that sticks with me. That's something that, you know, just speaks volumes. I hope that kind of shows you what, you know, Indigenous data sovereignty is compared to just regular data sovereignty. You know, there's these extra pieces that we have to be careful about and we have to put into our plans going forward so that we're not repeating, you know, history's messes, I guess you could say.
Thank you for
Sorry,
that.
yeah, that was a good
Really...
question that I was not prepared for. So that was kind of hard to, you know, say on the spot, but thank you for that question.
And thank you for that response. I think just even leaving that message with our participants is a good way to end. Thank you for, again, for coming and for this valuable work. Thank you everyone for participating. We're getting lots of messages of thanks, and it was terrific and really valuable information. So thank you, Sasha. And yeah, so I believe we put the feedback survey in the chat. If you're able to fill that out, that would be wonderful. And we're seeking volunteers for upcoming PDN webinars and complex case rounds. So if you're interested in doing that and presenting to a group, it would be wonderful to share the information and knowledge of this network and to this network. So thanks everyone again for participating and coming, and thank you, Sasha, and have a wonderful rest of your day.